Okay, Jeffrey, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Follow me. Everything you see is magnified 30 or 40 times on the screen. Right now we're using our shaver just to debride the labrum a little bit. We'll rotate and look down about 7 o'clock on the screen to give you a better picture here. And you can see this labrum's a bit torn here. We're going to go ahead and put a stitch through the biceps because it looks like that's going to be a source of pain if we just leave it. So in order to do that, we'll take a spinal needle here in just a second. And pass that through the tendon. So there you see the needle sneaking in. We'll get that right through the middle of the tendon, just like that. We'll pass a black wire through it. This is called a super shuttle. And there that goes. We'll grab that with a grasper, and then we're going to pull that out and load that with a stitch. Like that. So that's one half of what we have to do. We're going to do the same thing one more time by passing that needle for a second time through the tendon. So we'll go ahead and feed that through. And now we'll reach in and grab the relay here, back the needle out. Now we're going to reach around the back of the biceps to retrieve the relay here. This creates what we call kind of a purse string stitch. It gives us a much stronger bite on the tendon. Pause, please. Now that we have that bicep secured, we're going to go ahead and cut the biceps at its insertion. There it is, or there it goes, I should say. And now we're going to take our shaver and smooth out the undersurface of this rotator cuff tear. We'll show you the tear. It's over here. You can see all this torn tendon here. Spending some work repairing this too. That's looking pretty good. Take a look around inside the joint just to make sure there's nothing else to worry about. As we look down here at the anterior shoulder and then we come around and look at the posterior shoulder, the anatomy here so far is checking out okay. Some minor wear and tear changes, but no other significant tearing to worry about. So we're going to go off on the video. We'll keep working inside the joint a little bit more, but I think the next thing we show you will be our work in the subacromial space, working on this rotator cuff. Okay, so here you can see the tear in the tendon. We're going to place a suture anchor right about here. I'm trying to see if I need one or two. It looks like I'll probably be able to get this done with one anchor. So as I pull back, it gives you an overall perspective of the tear here. So we're going to place one anchor down. There's a little bit of a cyst in the bone. See that? And we can avoid that without any problem. Next you'll see a guide that we use. There it is coming down. And in just a minute you'll see our suture anchor coming down through the guide. There's the articular surface. We're going to come back just a little bit. And with the small anchor, that little cyst in the bone won't bother us at all. Go down right about here. We just bury it deeply. And then we'll check the fixation in just a minute here. Pause. Okay, so here's the anchor in the bone. It's very solid. We're going to take our crochet hook and we're going to take out one of the more posterior sutures here. So we'll take this blue and white one right here. Take that there. We'll take our suture hook here. And then from the right side of the screen, which is the front of your shoulder, we're going to reach in with a grasper. Now, your tear is not delaminated, so we can just grab this edge and reduce it. We're going to want to repair this tear. Something like that. Here's our first pass. And now we're going to load that with that suture that we've already taken inside the cannula over here. Push it in.